All right, we're gonna pick up our doctor, but hello everybody. It's Monday evening. I'm Lorna Owen, CEO of Desert Sage Lifestyle Wellness Company. If we're meeting for the first time, let me just tell you a little something, something. I'm a former nurse, midwife, I'm an attorney, and this is my jam, talking about women, women's health, empowering women, and the like. That is my jam. But I don't want to take up too much time because it's really not about me, right? Call your friends. Believe it or not, I have Dr. LaKeischa McMillan. She is a hormone specialist. She is a best-selling author. Her book is Your Survival Guide for Perimenopause. She's been featured on Oprah, on OWN, and she's here. She's a medical doctor. I told you that, right? And she's here to talk to us. And so here, Dr. McMillan, welcome. Thanks for coming on.
Thanks for having me, Lorna. I am so excited to be here. I love talking about this topic. So you're going to have to be like the Sandman that tells people it's time to get off the stage. You're gonna have to give me the
Yes.
time that it's time to go, because I can talk about this forever.
I so hear you, and we're glad. So here's the deal. Let me put a disclaimer.
Okay.
All the questions that I'm going to ask you, I'm
Okay.
asking for a friend, right? You understand?
I love it. I love it. Yes, yes, yes. Asking for a friend.
So, we mentioned about perimenopause, and I think that a lot of us don't even know that that exists. So, what I need for you to do first is to set the groundwork as to what era we're in, meaning what is perimenopause and what is menopause, and are they the same thing? So, go ahead, take it away.
Oh, I love this. I am a teacher at heart. So I love setting foundation, giving us what is it, definitions. And so perimenopause is the time leading up to the menopause phase of life. Some people call it the menopause transition. I call it purgatory
Yes,
because
ma'am.
it can last for 5, 7, 10, 15 years before you go into full blown menopause. And perimenopause can be wrought with so many different symptoms. And it's very individualized. A lot of people think that perimenopause or even menopause, and we're going to talk about what menopause is that you have to have a certain set of symptoms before you can actually say you're there. I've even heard some of my patients come to me and they go, "Oh, I didn't even go through menopause. I didn't go through." I'm like, "Ma'am, yes, you did," and I'll tell you why. And I even heard Halle Berry say on Trevor Noah's podcast here recently that she thought she was going to skip it. She was like, I just thought I wasn't even going to have to deal with that because I ate well. I was taking my supplements. I was taking care of myself. So I wasn't going to go through menopause or even perimenopause. So perimenopause is this time where your hormones start changing. And what do I mean by that? So when we go into adolescence and we go into our menarche is the official term for starting your period, is when your hormone levels, specifically your estrogen, your progesterone, and even your testosterone, start rising, and they rise in a cyclical fashion. That cyclical fashion gives you that 28-day cycle, that 30-day cycle, that 32-day cycle, which means every interval, I'm talking about these intervals, you will have a uterine lining shed if you don't have a pregnancy. Okay. So
Right.
the estrogen starts rising at a certain time. It starts rising first, then progesterone catches up. I say progesterone is like estrogen's accountability partner. Okay. Progesterone is the one that makes sure that estrogen doesn't make the grass grow as tall. What do I mean by that? Estrogen makes the uterine lining start thickening so that it can be ready for a nice egg to come and plop down and all that nutrients that's there. Progesterone is in charge of mowing the lawn. That is, if you don't have a fertilized egg, it will help you to have a cycle. Excuse me. So progesterone waits around for the memo, was there an egg fertilized? If there was no egg fertilized, progesterone says, hey guys, in 2 weeks, we're going to mow the lawn, but we got to wait 2 weeks to do that. And when 2 weeks comes by, then there's that shed of the uterine lining. That's when you see your period. Well, in perimenopause, estrogen starts rising. Sometimes progesterone rises, but then it falls too fast, too soon. So then you can start having this irregular cycle. You can start having intermediate spotting. Your cycle can either start coming closer together or further apart. It can change in characteristics. It can be heavy when it used to be light. It can be light when it used to be heavy. Some women start having cramps, have never experienced that in their entire life, and now they start having cramps. Some women start having trouble with their sleep. They can't get to sleep. They can't stay asleep. A lot of women start talking about, I just breathe and I gain weight, right? And they're like that pudge that starts coming. All of these are some of the symptoms that come about in perimenopause. So this is where those hormones are starting to are starting to not be at the level that they used to be. Now, menopause, excuse me, menopause. The textbook definition of menopause is 12 consecutive months without a period. That's it. And that's if you still have a uterus. So we're not talking about surgical menopause or anything like that. We are talking about if you have your uterus intact and you're not on any type of birth control or hormone therapy, you go 12 consecutive months and don't have a period. I did not say if you have hot flashes, night sweats, vaginal dryness. You all notice that. I didn't say you had to have these accompanying symptoms. That's it. So if you go 6 months and you have a period, you gotta start the clock over. If you go 9 months without a period and all of a sudden she shows back up, you gotta start the clock over. If you go 11 months, and yes, I've had patients that have gone 11 months and had a period, you have to start the clock over, because if you have gone 12 months without a period and you end up having a period and you're not on any hormone therapy, nothing else, we have to make sure there's no uterine cancer in your body, okay? So that's very important.
Wow, let me tell you. First of all, I've never heard it said like that. No wonder you are a teacher. So you talked about some of the symptoms. I don't know which one I was in, but all I could tell you, I couldn't remember diddly squat. I remember going to court, and I couldn't remember what my client's name was. And he was in jail and had to be brought out. Thank goodness the clerk has known me for a long, long time. I said,
Mm.
do you see my name on the calendar? Yes, Attorney Owens. What is my client's name? So he told me the client's name, right? And they all laughed and said, your next book is What is My Client's Name? But the big part of it for me, though, was when I was trying cases, I worried that I wouldn't remember words and it would look like
Yes.
I was stupid. I just could,
Yes.
yeah.
Yes.
So why does that have, what does that have to
Oh
do
my
with
goodness.
anything?
Oh my goodness. I just did a live yesterday about this. When your estrogen starts dipping, when your estrogen starts taking a dip, it actually interferes with it interferes with some of the neurotransmitters that are in the brain. And so your sex hormones, those that are, and when I say sex hormones, I'm talking specifically about estrogen, progesterone, and testosterone. Those three interact with other chemicals, which we call neurotransmitters in our brain. And it helps with cognition. Testosterone specifically helps with our memory, helps with us being able to focus. It interacts with that norepinephrine and epinephrine system. And believe me, I have been there. It actually recently, man, I've been there. I was giving a lecture and had a combination of 700 people. I had done 2 other lectures, sailed through those lectures, got to my 3rd lecture, and it literally left my brain completely, to the point where I had to say, excuse me, y'all, hold on. Let me start over and let me get my train of thought and go through and finish. And like you said, you're like, I don't want to look stupid. I don't want to look as if I'm having early onset dementia. What is going on with me? And these are some of the things that happen. And so being able to figure this out, and I use a phrase that I call her one of my super friends, Dr. Sam. She's
Oh, I know her. She's in Atlanta now, right? She
yes,
came from
yes, yes,
Miami.
yes,
Yes,
yes, yes.
amazing.
She says, test and don't guess. And that's what I do with my women. I show you what levels are dipping for you, what your body is doing at this time, so that you can get a personalized symptom solution blueprint and we can start really pulling the levers that are just right for you.
Oh, test and don't guess. That's a good one. That is a good one. So let me talking a little bit about Halle Berry, and I think a lot of people will get their medical information from Halle because she's Halle Berry.
Right,
But she
right, right.
said something very significant on Trevor Noah, and it's amazing that she'd say it like that to a guy. She talked about what happened in her vagina. So we're
Yes,
gonna go back and forth. So let me again, asking for a friend. I need to talk about vaginal dryness, vaginal atrophy, right?
yes,
What the hell
yes.
is that? And what do you mean? The vagina shrinks? So what is the person supposed to
Oh my gosh. So all of our tissues in our body, they have influence from the various different hormones. And the tissue in the vagina, the skin on our face, the skin that is all over our body loves estrogen, loves a particular type of estrogen actually as well, estradiol or E2. That I call it the fountain of youth, right? And so when our estrogen starts dipping, the vagina, and I should have, oh, I wish I had my pelvic model here. I may go off screen and get it.
Right, right. Don't worry. Yeah, don't worry.
But the vagina, when it's young and healthy and has the influence of the estrogen, it's like it has hills and valleys. So when I do a pelvic exam, when your doctor does a pelvic exam and they insert the speculum and they look, they can see the nice, healthy pink tissue. Everybody's vagina is pink, okay? Everybody's. And it looks like, and we call it rugae. The tissue has these nice dips and hills and valleys, and that is very healthy vaginal tissue. And it's tissue that can stretch. That's why when you give birth, it stretches and it can bounce back. Now, when the estrogen starts dipping, those hills and valleys, that vagina gets like an ice skating rink. It gets like doesn't have those hills and valleys anymore. But it also feels like parchment paper. It's dry, it rubs, it's very thin. I don't know if any of you remember, I just remember growing up and looking at the older women, per se in my church or something. I used to love go and hug on them, my grandmother's friends. And I would notice their hands the skin was so thin. I could see their vessels, their veins through it. And you would be afraid that if I held on too tight, I would tear their skin. It's the same concept. That skin in the vagina is very thin, it's very fragile. And like she was explaining, I mean, you having a good time, you may have some friction. And so there may be some tears that occur. And she described it as having micro tears that, somebody had asked her, well, you didn't feel it while you were actually, engaging in sex. And she's like, I mean, you got endorphins going on here. It feels good.
Right.
But afterwards, she tried to go to the bathroom. And when she went to urinate, that acidic urine hit that open tissue. It was an open sore. And
Right.
that's what was very painful. And that's what some women can experience. And it's called vaginal atrophy. Or you can also experience where it feels like it's a UTI because your bladder sits right on top of the vagina. And when the vagina is not as healthy as it used to be, the bladder is not as healthy as it used to be. And it actually kind of starts having these little spasms. So it feels like I gotta go, I gotta go, I gotta go all the time. That type of feeling as well.
So if the vagina has this roughness to it, can the men feel it? Does it affect the penis, or it's simply the wall of the vagina that succumbs to that kind of change
That's
in
a great question. That is a great question. What I believe happens is that your lubrication can actually be affected as well. So this is where the communication with your partner becomes very, very important, because the things that they used to do may not produce the same physiological response anymore. So they may touch you a certain way, and that used to turn you on. It still turns you on, but it doesn't produce the lubrication the way it used to. And so they can actually feel that, and they're like, okay, why isn't what's going on? I don't turn her on like I used to. And this is where the conversations start, where you start saying, you know what, if you still want to, because some women's libido goes down, their desire for sex decreases. If you still want to, you say, I still want to, there is something going on. So maybe we need to incorporate lube now. Maybe we need to incorporate a different type of foreplay that can actually prime the pump a little bit differently now. And it has nothing to do with me not being attracted to you or not wanting you anymore, but it has everything to do with my physiology changing.
But so who tells these people this? Who tells the woman that, and who tells the man that? I mean, how is a person supposed to know all of that?
These are the conversations we're starting to have because we did not have them before. Our mothers, our grandmothers, I don't think they even had the words to say what was going on, because we got the vernacular was, it was the change. She's just going through the change, or she's having a moment, those type of things, where if she's feeling a little bit more emotional, feeling a little bit more sad, oh, now she's depressed, or now she's anxious. And all of these things, this is how they come about. This is how it presents. And so a woman goes to her doctor or is with her family. She's just like, I don't know what's wrong with me, or doesn't even have the verbiage to say it. And
Right.
this is why these conversations, like the one that Oprah's going to have tonight on the menopause revolution, and so many others, and like our conversation here, these conversations are so important. And it's important to have this conversation with your partners, with your family. Because if you have children or if you have extended family, you need to have these conversations so people can understand what's going on. And we can also, what happens is when you start talking about it, the intensity of the symptoms can decrease. Some people will be able to find solutions faster because they now have the community around them. So to answer your question, who tells people that? Nowadays, I do. Nowadays, it's somebody like me that has the knowledge, that has the information, that's able to say to a woman that comes to me that says, I don't know what's going on with me. This and this and this. And she starts enumerating. I go, yeah, I wish I had a tape recorder that I could just push rewind and play, because you're not by yourself. There's so many other people, and I know how to help you.
Does men go through menopause?
They go through andropause.
What is
So
that?
their testosterone
Penis
starts.
falls off or something like that?
Now they start, their testosterone levels start falling. Men also produce estrogen, because your testosterone, some of it in men and women turn into estrogen. It's called aromatization. And men also produce progesterone. They just don't do it in the same levels as we do. And all of these things help with cognition, help with brain. I say this is why they become the grumpy old men, because their testosterone starts dropping, their estrogen starts dropping. So they don't, they get confused, but they may not show it. They just get a little more irritable, right? They
Right.
start having erectile dysfunction. So that's the thing that brings them to the doctor. That's the thing that brings them to somebody like me. If I, because there are people that treat both men and women, and they're looking for the testosterone replacement therapy. And that's the only thing they're looking for. But then I take them and say, hey, it's not just your testosterone. You got to take care of your adrenals. You got to take care of your gut. You got to take care of your thyroid as well. And you have to do some lifestyle changes.
Hmm. So the interesting thing is that we always said it's a changes, and so it was what it was, and so forth. And if it got really, really, really bad, where somebody feels really, really depressed, then they go to the doctor and they're put on medication. So walk me through that. What would that look like? And is medication the first port of entry?
Ah, I love that question. So when you look at what the recommendations are now and what the studies have actually revealed and what we've done when we've looked at an old study, and I'll get back to that. The Menopause Society of America, Menopause Society of America states that the gold standard for menopausal symptoms, especially what we call vasomotor symptoms, which is the hot flashes, night sweats, vaginal dryness, should be dealt with hormone replacement therapy within the first 5 years, because there is tremendous benefit to that. But that's as far as they're willing to go. And they say within 10 years of being on it, you need to talk to your doctor and see if this is something that you need to continue to be on. I'm going to take a step further, and I'm going to say there's a whole lot, there's a way to look at you as an integrated person and a whole person. And it's not just hormone replacement therapy. That's one of the tools. And we're going to get back to that. But you also need to make sure that your gut is healthy. And when I say your gut, I'm talking about your intestines. I'm talking about your microbiome. I'm talking about the little bacteria that actually help you to metabolize your hormones, that have been doing that since you had hormones on board. I'm also talking about your adrenals, which is that is the organ system that is in charge of your stress pathway, your stressors. This is what has been keeping you alive every day. It's your fight or flight and your parasympathetic, your rest digest system. That needs to be in balance. Also talking about your thyroid, also talking about your brain health. So looking at you as an entire human being. Now, talking about the hormone replacement therapy, this is such a hot topic because of the WHI study. And I feel I have a special place in kinship to this, because this study came out and was, prematurely halted and stopped when I first started residency. I had been a resident for all of 2 weeks. No, 2 weeks, had my MD for a whole month, and was proud. I had my long jacket on in the hospital, not the short one that said I was a student. Now I'm a resident. I got my long jacket on. And our program director comes into our morning report with this study in her hand, waving it, going, oh my gosh, we have to take them all off of this. We have to take them all off of this. And we're just like, what just happened? Well, in that study, it appeared that women that were on the estrogen and progesterone combination had an increased risk of breast cancer. What we have to realize is that the hormones those women were on there were synthetic hormones. We now deal with bioidentical hormones. So we don't even use the old stuff.
Meaning, for the person who's saying, what is
I
bioidentical,
know.
doctor?
So bioidentical looks just like what your body used to make. There's a difference between biological hormones and bioidentical. Biological hormones are what you make. You've been making them from your ovaries, from your adrenals. This is what your body makes. Bioidentical is made in a lab, but the main ingredient is an organic base. Mainly, usually, if we're talking about progesterone, it comes from yam root. Okay. And they make it to look just like that biological hormone. So there's a slide I usually put up when I'm doing a lecture, and I show the chemical structure of the two. They are identical. So the body knows exactly what to do with this. It goes, oh, I know what to do with this. I'm supposed to take this group off here. I'm supposed to turn this around. I'm supposed to switch this around. Oh, the liver does this. I'm going to send it over to the gut. The gut does this. And then we use what we need, and then the rest goes out. Synthetic hormones are like what is in birth control pills, what is like in Prempro or Premarin. These were made in a lab as well, but it was like, hey, let's try and make a key that can fit that lock. but it's not bioidentical. It does not look like what your body used to make. So the body takes this in and it goes, okay, it can fit this lock, but I don't know what to do with all this stuff. Well, let's take this group off here. Let's try and do this. I'm not sure what to do with this. Well, maybe the immune system knows what to do. So you have this inflammatory response. And so it does not get processed the same way. And all these little metabolites that are made by this chemical molecule run around in your body and run havoc in your body.
Ah,
So hormone therapy is a tool. Is it for everyone? No. I always say informed refusal is just as important as informed consent. So get all the information that you need so that you can make the right decision for yourself. What we know is that estrogen helps to decrease your risk for cardiovascular disease. We know that it decreases your risk for osteoporosis. We know that it decreases your risk for dementia. It also decreases your risk for certain types of breast cancer. We know that testosterone helps in the same way, progesterone as well. So all of these things have a protective effect and can help with your longevity. And we're living longer and we're doing more now.
mm, that's so let me ask you this. You're past perimenopause, you're out of menopause, and now you still have to deal with the physiology and the
Mhm,
anatomy and physiology of the vagina.
mhm,
It's dry, it's
mhm,
atrophied.
mhm.
What do you do? Do you um is over or oral or not yeah, oral or skin, the one you put on your skin,
Oh, like a
subdermal,
cream or a
the cream,
subdermal,
does it
yeah,
cream? Is the cream the
transdermal,
way to go, or there's I've been hearing about some surgery
surgery.
or some, tell me about that, please.
There's so many different options. And so my preference is to use a transdermal approach when it comes to bioidentical hormones, especially estrogen. Progesterone's a different story, but when it comes to estrogen and testosterone, I love to use something that's transdermal or subcutaneous because it will bypass the liver to have the liver break it down and really work the liver over time. So I'll use a cream or a patch. I do also use pellet therapy for some people, so I know that that is a tool, and there's a lot of conversations around that. But I know how to manage those patients, and so those are the things that I use. I also have some patients that need a direct what do I want to say, application of estrogen to the vaginal area. So there is a vaginal type of suppository cream that you can use to be able to help to make that tissue nice and healthy. So
Mhm.
there's a variety of things that you can do. And then there's some patients that just want to do a lube and say that that's fine, that works for them, and they're okay.
But isn't there also a laser thing or what? Something that
Oh, you're
you could
talking
use?
about like vaginal rejuvenation.
Yeah.
So I don't perform vaginal rejuvenation, so I have a very limited understanding of it. But from my understanding, is that it is a laser type of procedure. And what you're doing is you actually give a controlled amount of trauma to the tissue because it will heal. And in the healing process, it's supposed to help generate new tissue, that new epithelial layer, that dermal layer, and supposed to make it nice and healthy again. So that's where you can use that. I think is Rejuviderm or something like. I can't even remember the name of it, but that is a laser that can be used. And I know of some people that are using it. And now I have not had a lot of patients that have come to me that have used it and have found success. So I'm not quite sure of the follow up.
What do you tell, this is, um, first of all, tell us about the cruise you're doing, because it seemed to me one needs to be with you for a day or half a day or whatever, because this is just touching even touching the surface, even though you're very generous with your information. But Doc, I have more questions plus, right? And I know I'm going to get it, and I'm going to have to figure a way to get you to Florida so we can have like a substantive thing.
Powwow. Yes,
A
absolutely.
substantive thing.
Absolutely. So I am hosting the Sail into Hormone Balance cruise, brunch cruise here in the DMV. It's going to be the Sunday of Memorial Day weekend, so it's March 25th. And it's for, you know, that morning cruise, that brunch cruise time where you can come. We're going to have our own private section of the boat, and we're going to be able to have a roundtable discussion on vaginal health and dive in more, a little bit more on around this topic and perimenopause. And if you want to do the VIP ticket, you actually get your consultation with me added into that ticket.
Yeah.
So that's your one-on-one, and you can ask me anything.
All
And
right.
that's at hormonecruise.com. So you go to
Yeah, I was
hormonecruise.com.
going to ask you, hormonecruise.com. Also, we can also get some more information from you because you have a book, Survival Guide for Perimenopause and Menopause, and that is on Amazon. So you guys who want to go get the book, go get the book and start
Yes,
driving
yes.
me crazy, or go talk to the doctor. I'm just in the same boat as you guys are. I don't know any more about this than you do. I'm like, dear God, that's
Well,
what I'm
no, it's a
saying.
lot. It is the biggest top. You will spend the last third of your life in menopause. And I personally stopped using the term postmenopausal because I found when women came to me and they said, "Oh, I'm postmenopausal. I'm through with that." But they were telling me what they were experiencing. I'm like, that's still a part of this phase of life because things can change. Your stressors can change. Your environment can change, the responsibilities you have can change, your physiology can change. And so you can actually have different sets of symptoms that come and ebb and flow, and you'll need these different tools in your toolkit. And so I just tell you, the last third of your life, this is gonna, whatever you want to call it, menopause, postmenopause, this is where your body will change again, just like it changed when you went into adolescence and puberty. It's gonna change again.
Right, and that's a comfort knowing that it's going to change again, and also that this is normal. You're not out on,
Yes,
you're not out on in a boat by yourself drifting at sea.
exactly,
Like, who said,
exactly.
get ready, get ready, get ready, right? But also it's a joyous time, knowledge is potential power. So now you know. So you
Yes.
go have you go see the doctor and get it, and get with somebody you trust and that can help you through it, because it's normal. It's a rite of, it's a beautiful rite of
It is.
passage,
It
right?
is. It can, I mean, I remember hearing my mother and my aunties and, eavesdropping on their conversations about how, ooh, 40, and, you stop carrying the weight of other people's opinions and you start coming into yourself and you enjoy the skin you're in. And, some of those were the perks. And I was like, oh my gosh, yes, we're going to get there. And then I turned 40 and I was like, what just happened? Like, what is going on?
What is my patient's name? What is my client's name?
Yes, 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 yes. I mean, my own story. I got my own labs drawn when I was 40. This is 10 years, almost 11 years ago now. I had no measurable testosterone in my bloodstream. None. No measurable testosterone. And my DHEAS, which is a marker you can use to look at your adrenal health, was in the toilet. And I was like, no wonder I feel like I'm walking sideways every day.
Mm, mm.
So,
Interesting.
so I
Interesting.
am in the journey. I am on the journey with my patients. I tell them about my own stories and new things that I'm trying, and I'll go, oh well, I'm gonna try this week, or I'm gonna try this month, or these are the things that I'm doing for me because of my own personalization, and that's what I want other women to understand. It is such a personalized journey. You cannot measure yourself, you cannot put yourself up against anybody else. It is nice to be in camaraderie and know you're not going through this alone, and your journey is so unique and you need to honor that journey. and
Yes,
and
Anna,
don't
yeah.
and don't make yourself feel that something's wrong, that you've done something, that you are morally, destitute, or that you have a moral, what is there used to be a social construct, when they talked about menopause, that women had a spiritual deficiency. That's the way they looked at menopause around the 17 and 1800s.
There you go. There you go. There you go. Doctor, well, listen. Hey guys, this is beyond good. This is like really, really good. And we'll have to do something about it so we can, well, first, what you can do is go on the cruise. I mean, I'm just telling you, just go on the cruise, right? And get the book and get not just one copy of the book, but several copies of the book, because we all know somebody who knows someone who needs to hear that. Sounds like church that needs to hear this,
Yes,
because
yes,
people
yes.
go through alone, and some people it's very severe and they're depressed, and it's a rough time. It's a rough time. Don't you forget that we have our literary jazz brunch April 26th right here in DeLand. And tickets are on sale right now. We start with the brunch. We block off Indiana, and we block off the street. We have beautiful white tablecloth, fresh flowers, and remember, we're dining off of china that you all in DeLand gave. So women around the country come dine off the real china that the women in DeLand gave. But it's fun, it's lovely, but what we're doing this because we want to provide 100 scholarship to a what young woman to go to university in Ghana, Wisconsin, International University, to become a midwife. It's a 4-year program. And it's for the 4 years, the total is $10,000, which is really nothing when you think of what it costs to go to a university here in the United States. That 10,000 includes everything, not only tuition, board, clothes, clinicals, books. The only thing it does not include would be food.
Mm.
So, this is a big deal. That is my commitment. So go to desert-sage.co. If you can't come, shop. We have teas from around the world. We have green tea, black tea. We have teas for sleep. We have non-alcoholic wines and candles and lotions and potions. So, but most importantly, thank you, doctor, for that thing. And these are big deal. One of the some of the non-alcoholic drinks that we carry is one called sparkling tea from Copenhagen. Those are sold in Michelin star restaurants around the world, right? We have award-winning teas from Nepal and things of that nature. So we're good. We're good. But I am 100% committed to training 100 midwives for Africa. So shop, like, share. But listen, to get your so that you stop worrying about everything, go talk to the doctor. It ain't me. I'm just introducing you all to. You know where to, doctor. Please tell these people where to find you again.
Absolutely. You can find me on all social media platforms at Dr. LaKeisha MD. That's DrLakeischaMD. And if you can't make it to the cruise, you can schedule your one-on-one virtual consult visit with me by going to talkhormones.com. And I'll see you guys soon.
Yeah, guys, do it. It's worth it. It's lovely. And I want you to send this on to somebody else. And yeah, you all can call me. I'll tell you for sure how to get with her. Doctor, thank you so much. This is so generous. And we have to thank Dr. Randy. She's our people. She's our people for making it happen. Dr. Randy Nelson, a lot of you guys met her. These are our people. So peace and blessings. And we'll talk soon. Thanks a bunch. Namaste.